Coming up next, Sitting at 30 takes you downtown for the weekly luncheon meeting of the City Club of Portland. Live weekly coverage of City Club is produced through the facilities of Portland Cable Access. Now we join the City Club for this week's program.
Welcome to the City Club of Portland. I'm Paddy Tillett, the President-elect of the club. Child abuse is a pernicious and often invisible disease in our society, a disease that's apparently becoming more prevalent in our state. If its destructive course is to be stayed, we need to have a clear understanding of the roots of abuse and the remedies that are available to us. Our guest today is Ramona Foley, Director of the State Office of Services to Children and Families. But before introducing Ramona, I have the following announcements to make. Summer's officially here, so on June the 30th there'll be no program. Instead, have a safe and happy 4th of July weekend. Then on July the 7th, join us for an update on the state of Portland's police department with Mark Croker, Portland's Chief of Police. That'll be here at the MAC. As most of you already know from this week's bulletin, we lost one of our most enthusiastic members on Tuesday the 13th with the passing of Mel Bisgeier. Though Mel had been a Portlander and a City Club member for just a year and a half, he embraced Portland and this club in a way that made him beloved in a very short time. I met him at Butter's Gallery some months ago and was at once infected by his enthusiasm over what he had discovered in Portland. Mel attended nearly every Friday program, often standing at the door and greeting members as they arrived. He also brought his new Yorker's energy to the Chef series and to the Architecture series. Mel was a knowledgeable, dedicated member of the Affordable Housing Research Committee. He'd be greatly missed. We extend our sympathies to his family and friends, and especially to his daughter Anne and her husband John, who are also members of the City Club. Our board host today, seated at the head table, is Carol Wetherill, member of the Board of Governors and Professor of Education at Lewis and Clark College. She'll ask the first question of the speaker. Following Carol's questions, we'll open the program to questions from City Club members in the audience. Please be ready at the microphone while Carol is asking her question. And identify yourself as a City Club member and ask your question in 30 seconds or less. Now, last week we had 3 transgressors of the 30-second rule, so now I've devised a gentle reminder. So for those of you who wander into declamations, I'm going to wave this at you, and you'll know that you need to ask the question right away, please, and just let us get on with things. Broadcast of the City Club programs this quarter is made possible in part by corporate underwriting from Portland General Electric, Schwabe Williamson and Wyatt PC, and the Weyerhaeuser Company Foundation, and we're very grateful for their support. Why is it that in a state known nationally as progressive and innovative in child welfare services, child abuse in Oregon continues to rise? Ramona Foley is the recently appointed administrator of Oregon's State Office for Services to Children and Families. Previously, Ramona was Director of Family Preservation and Child Welfare Services in South Carolina. In a career spanning 3 decades, Ramona has also been President of the Association of Interstate Compact on the Placement of Children, President of the National Foster Care Managers Association, and is President-elect of the National Association of Public Child Welfare Administrators. Ramona's teaching and practice have received numerous national awards recognizing her as someone of exceptional ability in her field. We're very fortunate to have her here and to be able to apply her expertise and her determination, and I suspect her heart, to the vexing problem of child abuse in Oregon. Please join me in welcoming Ramona Foley.
Thank you, Patty. I'm delighted to be here, very appreciative of the invitation to come and speak to the club today. As Patty said, I've been in Oregon since August and have really fallen in love with the state. I'm ready for them to put those signs back up discouraging other people from moving out. It is so beautiful, and I really value the fact that historically Oregon's done such a wonderful job of keeping its state so beautiful. I came here last August, and one of the things I was asked to address is why I believe I was chosen for this particular position. And I think that the thing in my mind that I recall from coming through the interview process was I was looking at the time of the interview process at what was happening to caseloads around this country in child welfare services. And the thing that I was puzzled by is that the caseloads in Oregon were continuing to go up, whereas in a lot of jurisdictions around the country, the child abuse and neglect caseloads, foster care caseloads were actually beginning to either level off or to actually decline in some jurisdictions. So I came here with a background in child welfare and very committed to looking at this particular issue. And I've told people since I arrived able to spell child welfare, but I've had to learn how to spell Oregon. Because things are different when you go from state to state. How they are different will reflect a lot of the social policy issues in a particular state, how the judiciary operates, the use of the community and the volunteers in the community, those kinds of things. But I've been doing some traveling around, believing also that all the answers never lie within a capital city. There are a lot of things that can happen in Salem, but when you actually get down to where child welfare happens and where families are actually having interventions, that happens at a local level. So I have a strong commitment to making sure that we have a system that supports that local level where families actually come in contact with our system. Some of the wonderful things I had heard about Oregon were things like Oregon was the first state in the nation to start doing something called permanency planning. And this went back to the early 70s, and there was a fellow here named Vic Pike. And Vic Pike actually worked in Portland and was one of a group of folks involved with the Portland State University in coming up with some findings that said children should not spend their childhoods in foster care. And I was a follower of that permanency planning project, and so across the country in South Carolina, I got to know Vic Pike in the early 70s and greatly admired his work. And his work really did lead the way. What was happening in Oregon began to sort of take hold around the rest of the country in terms of us saying that children should not sit in foster care indefinitely. Other things were issues around safety nets. We now have safety nets in all of the communities in Oregon, places that families can access services without having to become known as child protective service cases. The strengths-based approach that came into place here in Oregon over the last 5 years, where we actually are looking at strengths of families and not just deficits whenever families come into our purview in the organization. Mediation, strong background here for mediation and resolving conflicts without having to take adversarial approaches unless it's absolutely necessary. Open adoptions. I once mentioned the possibility of open adoptions in South Carolina, and a judge said to me, "What are you talking about?" And I said, well, it's actually worked in some places. You know, if you think about the fact that many of the children who are being placed adoptively are older children. Some of them are teenagers. They know who their parents are and they know where their parents are. And it's kind of a unique concept. And the judge said, "Where'd you hear about that happening?" And I said, well, it was on the West Coast. It's in Oregon. The judge says, oh, never mind. It's on the West Coast. We're not going to do that in South Carolina. So some of the things that are so unique and so progressive still haven't actually caught on around the country. And yet those are the kinds of things that we want to continue doing and expanding to get better outcomes. Now, given those kinds of things, a couple of things I'll share with you about my philosophy in child welfare services, because that's where I have spent most of my career. One is that I think we, unfortunately, in this country, we're always going to need to have federal and state laws that speak to the protection of children. It would be a wonderful day in our society if we no longer had to have protective service laws, if we knew all children were well cared for, all children were wanted, all children are loved and nurtured. But that's not the reality. And so while we have laws that say when we are to step in as government and protect children, I also am sensitive to the fact we have to have a balance in those laws. We have to make sure that there are checks and balances, because government can be very, very intrusive. And we don't want government to be overly intrusive. We want to meet that point where we have to protect children, but we also don't want to interfere with families when families can be empowered to protect and care for their own children. The second philosophy I have about this is that when we do intervene, when SCF does get involved with families, we really need to try to leave families better off than before we knocked on that door. And we're not there anywhere in this country yet in public child welfare. But we need to keep in mind that the intervention itself can be very devastating for a family. And we need to be mindful of that, and that we'll say several things I'll talk about in a minute in terms of our workforce and who it is that knocks on those doors and how we make sure those workers are trained. Some of my staff has heard me say I've always been a big fan of Woody Allen's, and I was a bigger fan before he ended up in a caseload in Connecticut. But still, when you look at some of the things he said over the years, some of his quotes, one of the things he said once was that 85% of success is just showing up. And I thought about that one day, and I thought that what he was not talking about was child welfare services. Because child welfare can show up and can do a lot of damage if we do not have a trained, competent, and skilled workforce. And I believe that, having seen the results of many interventions over the years, and my commitment to the fact we have to continue to improve how we do the business in child welfare and how we intervene with families. The third piece I would say is that I believe we have to always hold up as a goal that we want to have a child welfare system in this country and in Oregon that is one that we would not be afraid if our own families had to use that system. Hopefully none of us would ever have to have intervention with child protection. But I look across this room and I know there are people in this room who will have children, who will have grandchildren, who will have relatives who at some point are going to have contact with a child welfare system in this country. And until we have a system that we have confidence in ourselves, those of us who work at SCF, we have to keep working to improve that system. Fourthly, I think we have to have a system that is accountable and that produces outcomes in return for the public's investment. And this is a real new concept, new meaning over the last 5 years in public child welfare. Public child welfare throughout this country for the last 30 or so years has been led by anecdotal information. We've been led by the fact that we're doing good things for children, so nobody needs to question us because we've got our hearts in the right places. And what's been happening over the last 5 years is we're moving closer and closer to having very good data about our child welfare systems in this country. And we are learning how to use that data to be able to look at trends, to be able to forecast what's going to happen in the next 5 years. And I think that's really exciting. When I talk to staff here in Oregon, but staff across the country, people say, you know, I don't know how we're going to do this. I don't know how to use data. And again, it's been sort of a departure from a traditional social work approach. So I say staff are usually in some grieving process. They're in some stage of grief as we look at how we're going to use the data. But I think it becomes critical because we're now applying some business principles to what has grown to be big business in this country, and that is the business of investing money in child welfare services. An example of the big business, some of you in this room are business folks, and I ran into someone who teaches at Stanford Law School, and he has taught there for a number of years. But about 8 years ago, he decided to take the job as the county director of social services in San Francisco. And he went to that job, which was quite a surprise to us, because to go from teaching law to running a county department of social services is a huge feat. He worked there for a year or two, and I had not seen him in about 5 years, and ran into him in a meeting about 2 weeks ago. And I said, I never heard what happened to you after you went to work in San Francisco. He said, well, I have to tell you, I just absolutely hated it. And I said, you did? And he said, yes. He said, I wanted people to do certain things, but I couldn't get them to do what I wanted them to do. He said, I had 1,400 staff, and it always felt like they were going in different directions. Everybody was doing their own thing. He said, I was so frustrated. He said, so finally, I left that job and I went back to teaching law. He said, but you know the odd thing, Ramona, is a year later, I was in San Francisco shopping, and I ran into one of my former caseworkers. And I had a brief conversation with him, and then the caseworker said, I hear you're thinking about leaving. And he said, it occurred to me, we had a huge disconnect. And that's something that I think we have to learn in government, and that is we can't have that disconnect. Whatever it is that we're saying that we're moving towards, whatever our mission is, whatever the direction is, we have to make sure that every member of the workforce knows that and is going in that same direction. And I think that's one of those very common business principles that's kind of a new concept in a child welfare system. So some of the things I found in my first year here, looking at this growth in caseload, I've seen in the newspaper and had watched over a couple of years the increase in child abuse and neglect in Oregon. As we began looking at those figures, what we actually found is the increase is in the number of reports more than in the number of families. Reporting went up about 10% this past year, 1999, so that we have about 34,000 reports of abuse and neglect in Oregon. But that is 26,000 families. And the number of families has increased very, very little, probably close to about 1%. What that tells us then is we need to pay attention to the fact that some families are having more than one report. That also gives us a sense that we need to pay more attention to what's reported the first time and how are we going to intervene sooner so that we can help families without the necessity of the second and sometimes the third report. The other thing was I was looking at the Oregon benchmarks, and it was noting the increase in abuse and neglect. And we went before the Progress Board and met with Jeff Tryons and his group, and I explained to them that for me, I thought it was critical that we start articulating to the public that the increase is not the actual physical abuse or sexual abuse of children in our state. The increase is in a category called threat of harm. And threat of harm is, again, a very progressive posture for Oregon to be in, because what it means is we're identifying families earlier before there's actual abuse or neglect of the child, and we're identifying families who there is imminent risk of abuse and neglect of the child. And in 1999, 55% of our substantiated or founded cases of abuse and neglect in Oregon were in this category of threat of harm. That says a lot of things to us in terms of where we need to put our energy around the importance of prevention, the importance of being able to access services for children before they become actual victims of abuse and neglect. So while that's the good news, the bad news, of course, is developing ways of addressing these needs. When I think of reframing, there's something in social work we call reframing, where you have to take a particular situation and you sort of think about how to put this in other words. And it reminds me of a Click and Clack. I don't know how many of you are fans of Click and Clack on Saturday morning, but Click and Clack had a joke on there about a teenage girl, and she's arguing with her dad, and she's saying that this fellow she's going out with is just a really wonderful person, and her dad says, well, I don't think so. He's not very respectful, and he doesn't have a job. He's not in school, and I'm not impressed. And the daughter says, but Dad, he is wonderful, and I don't see how you can say otherwise. You know he is doing 200 hours of community service. So reframing becomes very important to us when we think about what we're actually saying to the public that abuse and neglect is and what's actually happening with children in our system. One of the things we know also is that there's a huge influence on the child welfare system from domestic violence. And Oregon, again, was one of a couple of states that went further with defining its domestic violence as a reportable situation to the Child Protective Services system. The interesting thing about this, Minnesota was another state, and Minnesota passed a law that basically if there were children present when domestic violence occurred, then that could be in and of itself substantiated abuse. What's actually happened in Minnesota is they have increased their Child Protective Service caseload by more than 100%. And this year, their legislature rescinded their law, saying that this didn't really get us where we wanted to get. And that's something not in terms of rescinding the law, but something in terms of our policy on how we are going to intervene with families where domestic violence is a critical issue. Many of the moms in domestic violence situations do not want intervention from the department. They do not want intervention from Children and Family Services. As you know, there's a huge stigma related to that, and they are very afraid of losing their children to the system. And that's, in fact, that's borne out around the country, that many moms who are reported do, in fact, lose their children to the foster care system. In terms of foster care, Oregon experienced a 51% increase in its foster care caseload between December of '93 and December of '98. 51%. And this, again, is contrasted to a leveling off and, in some parts of the country, a decrease in the number of children in foster care. And as we've looked this year as to why this is happening, again, we know that domestic violence is one of the contributors. Another contributor is substance abuse. Some of you may have seen the report that came out from the Health Division about 2 weeks ago that talks about illegal drug use in Oregon and how we have tripled the number of individuals using illegal drugs. We need to know that that does influence our caseloads in human services. That definitely influence our caseloads in child welfare services. The other reason we know our caseloads may be higher than other states is we embrace the use of relatives to care for children when children cannot be safe in their own homes. So that of the 7,000 children we have in foster care right now, about a third of those children are living with relatives. And I contrast that with a state like the state I came from, South Carolina, where for about the last 12 years, our social policy was against a relative serving as a foster parent. We had children coming into foster care, but they did not go to relatives. Relatives were, in fact, shown the old AFDC door. Interestingly, now South Carolina's caseload in foster care is quite a bit lower than the one in Oregon. But when you look at who is remaining on TANF, who is remaining on welfare assistance, in South Carolina, 1/2 of the families remaining are a relative caring for a relative's child, whereas in Oregon, only 1/3 of the remaining cases are a relative caring for a relative's child. And this comparison's interesting. So those children are being cared for by someone else, but in some states, at least, that will be called foster care, and in other states, it's going to be called caretaker only in public assistance. So always having to look behind the numbers before we draw conclusions or before we have findings of what it is we're actually seeing. In 1997, Oregon was placing children in foster care at more than twice the national average. And yesterday, I got the 1998 figures. And with 33 states reporting, Oregon was 4th in high placements. And when I looked at that, I thought, now who would we be behind? Who would be higher than us in placing if everything we believe happens in society actually influences foster care? And the 3 states that were higher than us were Pennsylvania, New Mexico, and Michigan. So there's not an easy correlation between what does this look like from state to state. In terms of our figures in 1998, there was a 35.7% placement rate. And that's the comparison of children in substantiated cases and children who come into foster care. Now, the one thing, again, I would caution us about those numbers, and those numbers are going to be released nationally in a report, but the caution about those numbers is some of those are duplicates. Some of those are cases where the child had more than 2 reports substantiated or the child entered care twice. Only 2 statistics actually contribute to foster care growth, and that is who comes in and who goes out. That's very scientific, as you can tell. But those are the 2 things that actually will contribute to where we are in terms of our foster care growth. In Oregon, 40% of the children return home within 30 days. And that causes us to look at why did they have to come in to start with? What is it we could do differently so that the child and the family do not suffer the trauma of the removal of the child from the home? The other interesting figure is that when children do go back home, our average for return to foster care is higher than the national average. So that told us clearly we've got to pay attention to the front end of our system. We've got to know how staff are making those decisions, how they're making those recommendations to the court on who gets to go home and who stays in foster care. In adoptions, I arrived last August just in time for Oregon to receive 2 national adoption awards. I said that's always wonderful to get awards for something you had absolutely nothing to do with. And I would credit my predecessor, Kay Turan, and the staff here in Oregon, as well as the court system, the citizen review boards, and everybody else who is so critical in that process of adoption. And I think that's something Oregon should feel very proud of. Our numbers were very impressive. That now has left us with a couple of new challenges. One is we now have a federal law you may have heard of, the Adoption and Safe Families Act, which says that if a child is in foster care for 15 of the most recent 22 months, then SCF is supposed to file a petition to terminate the parent's rights. This law was passed by the same Congress that passed welfare reform. So for the first time in history, we actually have time frames on how long a child is supposed to be in foster care. That is posing a real challenge for organizations around this country, because when you think about how many services have to be available and appropriate for families who lose their children to foster care, it means we have to access those services very quickly. Another challenge is we have 250 children freed for adoption in Oregon, and they do not have identified families. We're working with the private adoption agencies to try to select families for these children. But that always poses a concern, because there's no intention in the law and in our Oregon's Senate Bill 408, which was our complying legislation, there's no intention to create legal orphans. Whenever we terminate the rights, the parental rights, it is for the purpose of the child being adopted. And we have not done ourselves any good, nor the children, if we have these rights terminated and those children do not have permanency through adoption. The other thing we need to do is be paying attention to the fact that we need post-finalization services. Adoption is so different now than it was in the 1950s and 1960s. And we are placing sibling groups, we're placing very difficult teenagers in some of these homes, and we shouldn't delude ourselves into thinking that those cases then will be closed and the families won't have other needs. These families will continue to have needs, but the value is that the child has a permanent loving family to stand behind that child if they can get the right services. And adoption assistance in this country and in Oregon, over the next couple of years, we'll have more children in adoption assistance than we have in foster care. That's another one of those figures that if we were forecasting, we would know this is going to change some of the work that we do. So what are we doing about all this? We are trying to articulate to our staff a vision that emphasizes the safety of children, emphasizes that children have to have permanent families, preferably their own, but if that doesn't work out, they have to have other permanent families, and the well-being of children. Another part of the federal law that you may or may not be aware of is Congress also will be sending a performance report. It's kind of like what education is doing now with report cards. Performance reports will come to each governor, and that performance report will reflect the state's 1998 data and how well the state does. Well, knowing that this report will come sometime this summer, we have gone ahead and broken our report down into individual branch reports. As you can imagine, it's always easy to say, this is what foster care looks like in the nation, this is what foster care looks like for the state of Oregon. Much more meaningful when we can say, this is what foster care looks like in Multnomah County. This is what foster care looks like in Lane County. So we're breaking those reports down so that our branch managers will each have their own branch reports and can then sit down with members of the community and say, here's where we are, where do we want to be a year from now, where do we want to be 2 years from now. Another thing we're working on are some policy issues, opening up the policies, getting input from folks outside the system to see if they are as good as they should be. Reunification, I mentioned services for children going home. We're trying to beef up our reunification services so that we have more confidence in those cases when children can go home, that those children are going to be safe and not have to re-enter care. Services to teenagers. When I came out, one of the things I noticed was we have a lot of homeless teens in this state. And we had sort of a message in our systems. Over the years, a couple of things have happened. I know OYA at one time was part of child welfare. The Commission on Children and Families was part of child welfare. And as an outsider coming in, it seemed to me what we had evolved to was a place where each of our systems would have a reason to say, that's not my problem. And I think the result of that can be that you see teens who really are not being served. Some of those children are SCF's problem. Some of those children are OYA's problem. So we're working together with those other organizations to try to get a sense of what does Oregon want to say about its homeless teens. Where do we think we can fill in these gaps so that these children are not simply living on the street whenever their parents walk away or are not responsible for caring for them? Making sure that our workforce is competent and skilled. One of the things that I noticed when I came here is that our training of our staff is done in such a way that we actually can have staff going into the field and starting to work with families before they've been through training. And I said that's one of those top issues that makes one lose sleep at night. Because again, when you think about a system that we're comfortable with, none of us want somebody knocking on our door to talk about whether or not we get to keep our children if they haven't been trained on how to do that. So we have to move to a system where the training is mandatory before the worker is allowed to pick up the case. And not just for caseworkers, we want to have good training for supervisors and for branch managers. Learning the skills of those jobs is different than having just been a good caseworker and suddenly being promoted to being a supervisor. And then lastly, I wanted to mention the service integration effort. You've heard about our cabinet. Gary Weeks is my boss, and we have the benefit in this state of having a cabinet that has most of the social service agencies within that cabinet. I consider OYA a service agency for kids, and it's not in the cabinet, but we're working closely with them as well. But the idea behind service integration is for many of our vulnerable families, and our figures show that 1 in 5 of our DHS, Department of Human Service clients, 1 in 5 is using 3 or more of our division services. When you have that kind of overlap in who your families are that you're working with, it means we need to do a better job of sitting down as divisions and trying to figure out how can we better serve these families. The worst case scenario now in the face of welfare reform and child welfare reform is you can actually have a mom who is being told by her AFS worker that she needs to get a job or go to training for her job. That same mom can have an alcohol and drug counselor telling her she needs to be in treatment, and then SCF shows up and says you need to stay home with your children. So this is very confusing. It would be confusing for us. It's very confusing for the families we work with. So one of the goals with service integration is to break down some of these barriers between the social service divisions and make sure that we're looking at families in a comprehensive way. And I think SCF stands to gain by that because so many of the families we're working with come to us not just in regards to issues with their children, but also in regards to issues that have brought them to AFS, or have brought them to alcohol and drug or to mental health. I think at this point I will stop and take questions, and hopefully this has generated some ideas for some discussion.
First of all, thank you, Ramona, for a most informative talk, and welcome to Oregon.
Thank you.
It is no secret that while child abuse happens within all economic groups, children living in poverty, approximately 1 in 5 around the country, are much more at risk as their families experience high levels of stress, and children of color within this group are disproportionately represented. If you were to turn your imagination loose, thinking legislatively, economically, educationally, you decide which way. What are 2 or 3 things that Oregonians could do to improve the quality of life for all children and families in our state?
One of the things that I've been impressed with that Oregonians do at a community level is they do invest in their communities. I've been so impressed as I've traveled around the state and gone to meetings that have to do with issues, as you describe, families who are very vulnerable families. There is overrepresentation of children of color in our child welfare system, and it doesn't take a lot to figure out that often that reflects issues, as you say, related to poverty, issues related to unemployment, issues related to discrimination. One of the interesting figures, though, is we also know when we look at poverty rates around the country, the poverty rates don't always dictate the size of caseload in child welfare. And this also tells us something different. This tells us that there are different levels of community tolerance as to what gets reported in child welfare, and if you are reported, what are the chances that your child's going to come into foster care. Child Welfare League of America has done quite a bit of data collection and have come to the realization that basically in this country, whether or not child protection and foster care happens for a particular group is pretty much a matter of geography. When you look across the country, there are no statistics that say each state is doing it alike, and then when you look within the state, again, you'll see that among counties, it's not all done alike. And my goal is that we invest in our communities to come to the table and help us say that across this state, we're going to have a consistent level of service. And then anything that the county wants to do beyond that is wonderful. But we have to know that every child has access to protection and, if necessary, out-of-home resources.
Tom Deering, City Club member. There have been instances in other states, and in Oregon perhaps too, of where children have been killed or very badly injured, where there either has not been intervention because of a mistake or because there has been intervention but it's been ineffective. Is that measured statistically at all? Do you have any comments about how we stand in that sort of thing and otherwise about that?
It is measured statistically, and when I first looked at the figures, I was very alarmed until I realized, once again, Oregon makes a point in its child fatalities report to measure the unexpected deaths of all children and whether or not those children get reported. When we look at the number of child deaths in cases that actually are known to the child welfare system, we do not look that differently from other states across the nation. But it's certainly something that we pay attention to, and I think in general, it's a place that the community rallies around the system, and often, unfortunately, to try to find out who's at fault, as opposed to what are the system lessons we've learned here and how are we going to change this outcome the next time around.
Thank you. Dr. Edward Press, City Club member, you had mentioned before the importance of prevention in your program. And I think you deserve commendation on the foster care and your activities in that way. But the foster care alone, which is desirable and which I think you're doing a good job, is not as important in my mind as prevention. And as Carol mentioned, prevention, although maybe most of your people are of color and so on, it isn't the race or the color, but I think it's primarily poverty, unemployment, underemployment, all of those, alcohol abuse, illegal drug abuse, all of those things is what lead to it. And in order for you to do a good job, I think you need to devote a lot of your assets on prevention. Now, what percentage and what amount of budget funds do you allocate to either directly yourself or with other agencies that are aimed at that to working on alleviation of poverty, which would be primarily education, vocational training, vocational placement, alcoholism treatment, and so on, which I think are the root causes. So my question is, what percentage of your efforts and your budget are devoted to prevention from that aspect?
I cannot give you an exact dollar figure. I can tell you that from SCF's perspective, the prevention effort primarily in our state is done through our sister agency, the Commission on Children and Families. We do receive some federal dollars, not a lot of federal dollars, for family preservation services, family support services. Those dollars primarily go over to support the safety nets in the system. And I certainly wouldn't dare to try to tell you across our other divisions how many of those dollars are allocated for prevention. I personally believe it's not nearly what we need to be putting into the system. And it's interesting that in this country we are willing to invest so much more in our prisons, in our locked facilities for children, the way our federal funding streams in this country in child welfare. The federal funding streams gravitate towards the most expensive foster care placements, not around trying to keep children out of foster care. So I'm committed to looking at that. It's certainly going to be a shared responsibility and one that we need an awful lot of community input on what are the best ways, what are the best strategies. Some of the programs we have great hope for. I know there are folks here who work with some of the relief nurseries in this state. There are folks here who are also involved with other prevention efforts, Healthy Start, family visitation. Those are marvelous, marvelous programs. And what kind of defies me, having been in this business for so long, is we do know some of the things that work, and yet we have a hard time in our society saying to people, if we invest in the front end of these systems, we will in fact be able to preserve families and save a lot of kids from these worst outcomes.
Do you refer quite a few of your patients to these agencies? And if so, do you ever check on the outcome of those that you have referred?
Yes, we refer a lot of our families, especially the unfounded cases where a report comes in to us, it does not meet the law in terms of substantiation, and we refer those often to the safety net. The safety net probably is not funded at a level to take care of all of the needs of those unfounded cases, but this year we've also invested in an evaluation project to try to trace and see how many of the families that we referred actually were able to get help and not end up in a second referral or in another case of abuse and neglect. The wonderful thing about prevention is that if prevention and when prevention works, those are cases we never hear of in SCF. And that's a marvelous thing. It makes it a little harder to research or do the evaluation because many of those families do get helped in the community and therefore don't come through the portal of entry of protective services.
Thank you.
Thank you.
Ann Kelly Feeney, City Club member. My question was really asked by the previous speaker about prevention, but I just thought perhaps you'd want to elaborate more on how you see Oregon's record in prevention stacking up with the rest of the country. What are we doing that's really the most progressive? And are your colleagues in the sister agencies working to have a strategy for the next legislative session to fund Healthy Start fully for the whole state? What sort of strategies are being thought about in Salem for really focusing on prevention?
Well, and since I didn't bring my colleagues with me, I don't want to get in the way of speaking for them, but one of the organizations we work very closely with is Donna Middleton and the Commission on Children and Families. And I think Donna has been in her position for about the last 2 years and has a real strong focus on family preservation, on preventive services. And I think simply because Oregon, the unique thing is that family preservation, that prevention piece is outside of SCF. The thing that is really worthy on that is that oftentimes what's happened in our country is if the family preservation or the prevention effort becomes part of the child protection system, you go back a year or two later and there is no prevention being done. Child protection will often seem like the emergency room at a hospital, and it's too easy to have those dollars filtered off going in other directions. So I'm very hopeful, and we're working closely. Donna is now on our SCF advisory committee. We have reactivated a committee that by law says we have 21 members to give us advice on our programs. And we're seeking that advice before we make decisions on programs. We're circulating any policies, any ideas we have about prevention. And I would leave you with the thought that we are very open to anything that we can do. You know, one of the things you come to realize in child welfare is we want our business to be smaller. We don't want our business in child protection to have to get larger and larger and larger. But we want it to be smaller because families are being helped before they become a child protective service statistic. And we're not there in our society. I think some states are in better shape than we are. We probably are not at the bottom of the line on that. And as I said when I first started talking, the safety net is such a unique approach. The safety net, the involvement of local organizations and local citizens in what do we want to say in our community. And that is still seen as unique around the country.
Katie King, Short City Club member. The question I have is a little bit of the personal nature. The job that you've taken on is one that's often been described as a lightning rod for controversy. And I was wondering, whatever induced you to take this challenge on?
Well, and in fairness, the recruitment process, they did give us all the newspaper articles out of Oregon for the previous 5 or 6 years. It was quite a stack, I'm telling you. It was about like this. But having known Kay for the last 5 years at the national level, I also was aware of some of the controversy. The other thing I would say is public child welfare is a lightning rod. I'm aware of some of those things that happened here in this state. I'm also aware that I have inherited some of the fan clubs that my predecessor had. And at the same time, most of us that stay in this business and have a passion in child welfare, it's not because of the lightning rod issues. It's not because of the small percentage of cases that you read about in the newspaper. It is because of the good work that happens on a daily basis that no one ever talks about. It's because of those families that are helped, those families that are reunified, those children that get adoptive placements. And that's where the real rewards are, and that's really what motivates most of the people in this country who stay in public child welfare.
Thank you.
Elaine Kogan, you spoke earlier on about the need for more or different training for the people in the field. And I think we've all read horror stories about bad judgment or after the fact, what could have been done, wasn't done, etc. So would you elaborate on that, on whether are we starting with the people you hire, should be educated differently, or training for people who are already in the field?
There's a crisis pretty much in child welfare in this country in terms of the employment of caseworkers in child welfare. And that crisis relates to a couple of things, one of which is we are living in a time of a very good economy. Workers have other opportunities. Young workers coming out of college, workers who have had 2 years of college, they have opportunities to do other things that don't have the same level of liability involved, don't have the same level of media attention. So we are having to look at different ways of recruiting. Recruiting, we've got to be more flexible in making sure that some of our workforce, that a lot of our workforce in fact look like many of the families of color that we're working with. We have to be sensitive to that. We need more bilingual staff coming into our workforce. But when I talk about the training, I think that one of the things that has struck me is that we don't have a set core curricula that every single worker must go through before they are given assignments. And I think that should be the goal of any public child welfare system, and Portland State University has been wonderful to work with us to say, yes, we realize that too, and we're very willing. They do a lot of our training for us at PSU here. They are also willing to make some of that training accessible in other parts of the state, so that we would start with a premise that we want to have core training available to every worker who's going to pick up a caseload, and then on top of that, the worker gets other kinds of specialized training, like adoptions, for example. Not every worker who's going to work in child welfare may need adoptions training, but every worker needs that core basis. I think we have to build that in, we have to make it available to staff, and then we set it as a state standard, and we live by that. We then no longer, a year, 2 years from now, will allow staff to be given cases and having to make those critical decisions. In terms of bad outcomes, very quickly, I'd say when you look across the country, I've reviewed an awful lot of child fatality records in my career. And the thing that makes you the least comfortable of all, it's always sad to read a child fatality record, but if you have one worker trying to make those decisions on their own, dealing with issues of domestic violence, dealing with issues related to alcohol and drug, and no support from the system behind that worker, that is the most frightening thing you can read in a child fatality report. So we have to have good supervision for the workers, they have to be properly trained, and critical decisions that result in life or death of a child cannot be arbitrary decisions. They must be made jointly. Within our own staff, there must be team decision making, and we also have to use the expertise of other partners in the community.
I'm Bill Crane. I'm a City Club member also. Could you tell me about, in Oregon and perhaps across the nation, are the standards, the qualifications for family members who become custodial caregivers and for certified foster care people, are those standards the same? And of those two classes of people, family folks and non-family folks, are they paid and at the same rate and so forth?
There are national standards, but those standards are simply recommended standards, and they are published by the Child Welfare League of America. Every state then establishes its own state law and its own set of regulations as to what the criteria will be for foster families and adoptive families within that state. So by and large, you get a lot of similarity in terms of safety issues. There have to be fire inspections, health inspections. But then in terms of what kind of criminal records might be allowed in a particular family, there's variation. Right now, we're at a place that we're concerned enough about safety that our foster families in this state also have to have FBI checks. Fingerprint checks are done of all of our new families coming through the system. And that's become pretty much standard around the country. As of March of this year, the federal regulations now require that the relatives who are providing foster care meet the same standards as non-relatives. There has been a growing concern about the fact that workers might overlook some safety issues in the name of keeping the child with relatives. So that's become sort of a national debate, and now the standards are the same. You can waive certain standards. You can waive things like maybe the amount of space in the home. You can never waive safety issues. So whatever Oregon we have established in our rules, what the criteria are for being a family and what kind of criminal record, and we can't go away from that. There are 3 states in the nation that do not pay relatives for foster care, and ours is one of those states, though we can pay the relative if the child is eligible for federal reimbursement, and that's called 4E, but that's probably a little more detail than you want.
Kurt Wabring, member. About half of your caseload are children under 6. Suppose the legislature came to you and said, we will increase your budget by 10 to 20% if you can substantially reduce that. Tell us what new initiatives you would do. How would you respond?
I would immediately want to talk to our partners who do preventive services to talk about things like wraparound services for families. What kinds of things are in each community lacking that mean that we have this large number of very young children coming into our system? Some of the work that's been done about early brain development, I've been real disappointed that states haven't just seized that and gone immediately. It's like we often know better than we do in social services in this country. Some of the work that came out here from Ghost in the Nursery, that whole piece of research that's been done that tells me that that really is the direction we need to go in if we're going to start building the next generation of young families in a healthier way. I have to tell you that you posed that concern in terms of young children. We also have to continue, I think, to be vigilant about older children, because the older children that are in our system will in fact be those parents within the next 2 years and 3 years. So it's like not being able to ignore any one of these populations. But certainly there's so many things, I think, so many ideas even within this audience of what we could do differently with additional resources in that 0 to 6 category.
Ramona, I have some written questions from the floor. The first is that the Oregonian recently ran a series of 8 articles about families falling through the cracks in the system. What community safety nets are in place for high-risk families? And the second related question is, what is the safety net program?
Okay. It's another one of those marvelous things I can take no credit for. It started probably 5 or 6 years ago with the concept that we need to build community support for what's happening to families. Families are not government families. Families belong to communities. The children belong to the communities. They come from the very neighborhoods that people in this room come from. And so the concept of safety net is it's a configuration of services available at a local level that families can access, and it may look different from one community to the other, but it's prevention-focused efforts. It can be things like parenting classes. It can be things like offering day treatment to families so they don't have to become known to the foster care system. But it will look different in each community. And if it's something in your community that you're not aware of, I go around the state and I encourage people to contact the Commission on Children and Families. Talk about what does it look like in my community and what should it look like? Is it taking care of some of the needs? But it's a very creative approach, and as I say, it will look a little different from community to community. But one of the things, as we mentioned earlier, we're very invested in now is knowing what the outcomes are. Not just that there are places to refer families, but can this actually activate help so that families don't become further known to the system? In terms of organizations working together, some of the saddest situations that I've seen, and again, this may be the series of articles you're referring to, are parents who have emotionally disturbed children, and emotionally disturbed children who are not being able to access certain services. And across this country, that is an increasing problem, especially as we have very highly specialized need children being adopted. Families are going to have a more open door policy to access services. We do have the benefit of the Oregon Health Plan here. But if families aren't able to operate without getting additional assistance, it's simply a matter of time till we know those families end up getting reported to social services. Those families end up having to access the foster care system. We have approximately, we think about 200 children in the system right now where families simply could not access appropriate services for their children. And they have done what we call a voluntary placement for their children to come to SCF. That's very sad in my mind, because the foster care system was developed for children who are unsafe. Sometimes these children, it's not a matter of safety, it's simply that the family has done all it can do. If you saw the case of the couple in Corvallis, who really desperately needed help and had run out of alternatives whenever they finally took their child to the hospital and said, we can't deal with this anymore. We have a lot of those families, not all of them make the news, but that is a growing concern, and for us in SCF it's even more growing given the special needs of many of the children we're placing adoptively right now.
One more question from the floor. Do you have any statistics regarding adoptions by foster parents?
Yes, across this country and in Oregon, about 60% of the adoptions done by the public agency are foster parent adoptions. And that's a wonderful thing when it happens, when the child is already in that home, is already bonded with that family. I have to tell you, when I started out as a caseworker in 1967, there were 3 things we were told, and one was foster parents are never allowed to adopt under any circumstances, and 2, if you hear that foster parent or that child acting like they're bonding, you go and you remove that child. The 3rd thing we were trained is that if you place a child in foster care, they're not allowed to see their parent until they are completely what we call settled in. They show no emotion at all. So sometimes after 30-some years, I have to think back to how far we have come to realize that we have come a long way in this country. We've still just got a long way to go, but it's a very exciting opportunity for us. I appreciate the opportunity to come here today and share with you all some of the direction we're trying to take at SCF. Thank you.
Thank you very much, Ramona. We are adjourned. Thank you.
I've just finished my questions and now it's swimsuit. Feels like a Miss America pageant, you know, where they come up and ask these questions.
Council where she has it on the school for the year. She finds nobody and she's, they have school council, well, she shows up, she's going to suspend it.